You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you so much for joining me in the Dental Zone podcast. You can learn more by jumping on over to holisticdentistry.au, but for now, let's get in the zone. You're joining me on what might be my most controversial podcast so far, or ever, where I'm going to expose the darker side of dentistry and some of the mistruths, misleading scientific bits of information, and maybe downright lies that I was told as a dental student during my training and studies. Lies that, as dentists, we are then believing and repeating to our patients, which then allows us to provide types of dentistry that are potentially dangerous to your health and well-being. Today I want to talk about something that's going to be a little bit controversial, is to say that everything that I was taught in dental school is wrong. So I want to talk about the dangers of dentistry and also what I called health-centred dentistry as well. I'm going to start again with the premise that everything I learned in dental school was wrong. I was taught that mercury is locked up in the fillings once you mix it up in the amalgam, that it doesn't leak out. I was taught that fluoride prevented tooth decay by making enamel harder. I was taught that surgery was the only way to treat advanced gum disease. And I was taught that root canals were safe and so on. I was taught that people grind their teeth because they're stressed, and that, gum disease is irreversible, that once you've got decay bacteria, that's pretty much it for life, and so on and so on. But as time has gone on, I've come to understand that everything I was taught in dental school is not actually correct, and a lot of it was wrong. Mercury comes off every amalgam filling ever made. Fluoride makes the bacteria in your mouth sick, and it also makes you sick too. Now, if you kill off the good bacteria, then bad bacteria in your mouth are going to breed. Bad bacteria in your mouth are responsible for gum disease. And what we can do is, if we can change that bacterial makeup by exposing them to oxygen, for example, we can actually make them die. We can treat them without having to harm the rest of the body. So we need to understand the toxicology of dentistry, and not just the mechanics and the engineering and, the medical side of it. We need to understand toxicology and what impact is what we're doing having on the human body, and the bacteria that live in our mouth that are actually part of our gut and part of our microbiome. So if we can understand how this impacts on the body and our health, then when we look at dentistry that way, what I was told in dental school is wrong. So we can put fillings in people's teeth, but if they're harming their health because they're toxic, then amalgam fillings aren't good. So we can stop gum infections. They're totally controllable. Tooth decay is an infection, and it's not caused by a lack or a deficiency of fluoride. It's caused by diet and bacterial buildup. We can kill those germs with ozone and iodine. That's going to kill those bacteria. We can disinfect your gums without harming you. So you can have healthy teeth all of your life. But for this to be effective, you've got to play your part. You have to take responsibility for how you care for you every day. Not just brushing and flossing and using mouth rinse, but how you care for the whole being. So that's what you eat, what you drink, how you sleep, how you breathe, your relationships, your interactions, your exposure to toxins, what you get exposed to in the environment, how you are in your internal environment, your internal languaging and how you talk to yourself, your emotions and what you're willing to let go of and heal. So, how you care for you every day is going to impact your health and well-being from top to toe, and that includes your teeth, your gums and the insides of your mouth as well. So infections from your teeth and gums will spread through your bloodstream and they will infect the rest of your body. Gum disease causes inflammation in the mouth and throughout the entire body. Inflammation prematurely ages you. It makes your body sick. Fluoride causes inflammation. So brushing your teeth with a fluoridated toothpaste every day, your gums become inflamed. It's going to bring white blood cells to the surface, and that's going to allow parasites and bugs that are associated with gum disease to move into your gum tissue, spread further, go deeper, and seed out into your bloodstream. Now, the plan is to kill those germs and make them go away, not to treat gum disease with surgery by cutting and opening up and peeling bits of gum out, scraping goop away, and then sewing things back together. Surely, if we can disinfect the gums, get rid of the bacteria, we can avoid, invasive and painful and maybe unnecessary surgery. Now, there's well-grounded scientific literature to support the information about why we work holistically. So why doesn't dentistry adopt these practices? For example, we're a profession that still uses and teaches new graduates to use amalgam, even though we know it contains mercury and that mercury leaks out of the filling into the rest of the body. We know mercury is a poison and it's highly toxic. It's a heavy metal and it has no safe exposure limit. And so why do we as dentists still want to use it? Why do we still say it's safe and we tell our patients it's okay to have it in our teeth? Amalgam fillings contain mercury, that it's a poison, it's highly toxic, there's no safe exposure limit, yet we're still encouraging dentists to use it. Our profession thinks it's okay, and we're training our new graduates to use it. Now, the fundamental reason why we still have amalgam in use is because we call them silver fillings. It's because we're deceiving our patients. Let's stop calling them silver fillings. Let's call them what they are, mercury fillings. Now, if I told you I was going to put a mercury filling into your mouth, would you question that? Would you stop and wonder what the hell your dentist was doing if they said, I'm putting mercury in your mouth? Now, a lot of people would. But when I tell you, not me personally, we, the dental profession, tell you, I'm putting a silver filling in, where does your mind go? To me, I go, silver, yeah, that's like gold. That's cool. Silver's nice. I have a bit of bling. No one's sitting there going, you're putting something toxic in. It's a deceit to call them silver fillings. And even calling them amalgam is a bit tricky because people off the street don't know what that means. So let's call them what they are. So as I said to you, if I told you I was going to put mercury in your tooth, would you be happy to have one? Let's face it, to place a silver filling or amalgam filling, I actually have to mutilate your tooth because I have to drill away far more tooth structure than is affected by the tooth decay, because that mercury filling doesn't stick to your tooth, no, it sits in the hole. So we have to wedge it into a specifically shaped hole, otherwise it's going to fall straight out. And so I have to take more tooth structure away if I'm going to use a mercury filling than if I put a white one in. Getting rid of inflammation is a key to health, absolutely. So anything we can do to reduce inflammation, reduce our toxic load, either by what we're eating, how we're living, what products we're using on our skin and house cleaning and so on, that's going to go a long way to reducing inflammation. Stress will increase inflammation, as will negativity, anger, frustration, negative emotions, lack of sleep, and so forth. So to get that mercury filling to stay in your tooth, as you drill deeper, you've got to go out wider and undercut the tooth and make this wedge-shaped hole to hold the filling in place. So it's made wider at the base than it is at the top. This means I'm having to take away healthy tooth to make the silver filling work. It also means I'm weakening your tooth and it's making it much more prone to cracking and fracturing as time goes on. So that's the dental downside, that those amalgam fillings will split and break teeth over time. So a lot of dentists don't like them because of that, but they're not considering that there's mercury. So mercury leaks to every organ in your body. So how come dentistry is still allowed to use this? Why haven't we got FDA laws or TGA laws as it is? You know, the people who govern pharmaceuticals and medical to say, hang on guys, you've got to stop using this. Well, the problem is there is an organisation that has a stranglehold on the profession. They control you being able to get your dental licence, so to be able to register to practice. And so if you're a mercury-free dentist, other dentists will complain about you and they will attack you, particularly if you're high profile. So being here live, doing my videos in the way I am, I'm very outspoken because I believe that you guys need to know this information. But it makes us a target from within our own profession. And they threaten that they might take your licence away, particularly in the United States. Hey Anne, great to see you here from England. Thanks for joining. I'm talking about that everything I was taught in dental school is wrong. And at the moment, I'm just on a little bit of a rant about mercury fillings and why dentists are still allowed to use them. So there you are, you're this high-profile holistic dentist, you're known in your neighbourhood, and other dentists can complain about you and they can make threats to take your licence away. And I've seen this happen in the United States. So there's this big fear factor being instilled that if you practice holistically, you're going to lose your licence and you may never practice again. Now, that sends a message to dentists to toe the party line. So the dental associations hold a lot of sway in the universities, particularly with what they teach, especially in the United States. Look, for one example, New York University School of Dentistry, they tried to stop teaching its students to use mercury fillings, and the American Dental Association threatened to take away its accreditation if they stopped teaching mercury. Why is that? Why are we holding on to something that is a 200-year-old material that's toxic to your body, doesn't look nice in your teeth, breaks your teeth open, when we've got better techniques, better materials, things that look beautiful and don't impact on your health and well-being? In fact, they're going to be far more supportive. They're not going to cause damage and inflammation and harm in the body. So just talk a little bit more about the American Dental Association. They've got 35 members on the dental division for the Centre of Disease Control. Now, their only answer to treating tooth decay is to add silicofluoride or fluoride to the water supply, which does nothing for oral health. In fact, it damages the enamel. It's seen as mottling on the teeth, called fluorosis. And, you know, that's happening to even babies who are drinking it. The silicofluoride comes from China, Mexico, Japan. It's a fake program, in my opinion. It's funded by mega dollars annually, and these grants go to water companies because they're being told it's the only way to prevent tooth decay. But I'm going to say it again. What we have been told in dental school is wrong. When it comes to the toxicology of dentistry, it's wrong. And Anne's just saying there that they're carrying on because dentists are afraid of the new and the right thing to do because it breaks the mould. They have to stand outside of the square and be different and be willing to cop the flak and be a target. And I have to take my hat off to every single holistic dentist who went before me, only the handful that I know, who paved the way for us as the next wave to come through and say, no, there's a different way. And hopefully I'm setting up a way here by sharing information and educating for more dentists who are coming through to start questioning and look at this differently. And the pressure has to come from the public. It needs to come from you guys. If you're asking for a different way, we have to respond and change. So again, everything we've been told is wrong. So do you think, because I do think, but to answer the question, do you think it's okay for an accreditation arm to also be the advisory arm of the profession? So you've got the people saying you can be accredited, advising on what we can and can't do. Doesn't seem right to me. Do you think that A regulator should maybe act independently from outside the group who's got no vested interest. And perhaps if you knew that the American Dental Association actually held patents for mercury fillings and at the same time was mandating that dental schools still keep teaching this and that dentists were to use it and threatening your licence if you didn't, that smacks of unilateral control and vested interest. But that is exactly what is happening. So imagine that happening in other industries and trade associations. So maybe you have the Cement Association and they're going to accredit engineers, but they're only going to accredit them if the engineer says everything has to be made out of concrete. Yeah, look, this is what's going on. So it's interesting to see what goes on behind the scenes, and America really dictates to its dentists what they can and can't do. And I'm afraid then countries like Australia and the UK tend to follow suit because, we're sheeple. We don't have the ability to think for ourselves. We're all running around bleating in the field going, well, if they're doing it, we should do it too. So the American Dental Association got dismissed from a lawsuit in California because they argued that they owe no duty of care to the public. I'll repeat that again. They said they have no duty of care to the public, that they're representative of the profession, and hence it's not up to them what we do and don't use. They're not responsible and they can do as they please. Yeah, that's a bit of a cop-out. So that's a bit like me saying, well, I'm just following orders, So here's something that I learned through experience and that I wasn't taught at dental school. Now, it's common practice to do what's called a fluoride treatment at regular dental checkups, particularly on children. And look, you may have experienced this. You go to the dentist, they do your checkup, they clean the teeth, and then they stick these great big trays full of minty goop in your mouth. Now, this is called a fluoride treatment, and it's concentrated fluoride gel, about 5,000 parts per million, if I remember rightly. And look, I might have that a little bit incorrect, so I do apologise. I haven't sat down and looked up the numbers. So what I noticed is that on the kids department, which is where we treat children at dental school, during our training, we were expected to do this fluoride treatment on every single child that they saw. So you fill these mouth trays, they cover the teeth, you put a gel of concentrated fluoride in, place it over the teeth, and they're supposed to sit there for a couple of minutes with it in, not swallow it, spit it out, maybe we get a little suction in. Well, I lost count, and I'm not kidding, and it used to be Monday morning. You had a weekend, you come in Monday morning, you've got all these children to treat, and they used to pull the trays out and they'd vomit into the sink. And they'd do that during or after the treatment. So I, in my mind, had already put two and two together, that the fluoride in those trays, the gel in that tray, was actually making the kids lose the content of their stomachs. It was nothing to do with the tray touching the back of their mouth and making them gag. It was actually the fluoride. So I didn't think this was a particularly good thing that kids were vomiting during this process. And not for them or for me, and I really didn't want to have to clean it up. I'm left with an upset bowl full of, an upset kid, a bowl full of chunks, and I've got to clean that up. Yes, this is the glamorous side of dentistry, folks. You get covered in blood, spit and puke. Yeah. Am I selling it to you? Do I want to become a dentist? Maybe not. Okay. But what I didn't know at the time was that they were being sick, and it was never discussed as part of our training. But I knew something was up. And I didn't want any more vomit incidents, so I decided I wouldn't do any more fluoride trays for my patients. But once I graduated and I got my hands on what they call a material data safety sheet, which gives you all the information about a product, what its side effects are, what to do if someone gets it in their eye, swallows it, etc., etc. So I read this sheet for fluoride gel, and one of its side effects is that if you absorb too much through the tissues of your mouth, it will cause nausea. Oh, really? Come on, go figure. You're putting a poison into someone's mouth and the body responds by puking. That to me is very good common sense of what the body does, but it also exposes that gel does have side effects. It's not a safe thing to use, and I look back and gosh, I wonder how much of that stuff did they swallow? How much did they absorb? Oh my gosh, I felt really bad about it, but when you don't know different, you don't do different. But there is an opportunity now. We have so much information at our fingertips to be able to read about dental materials, mercury, fluoride, and come to our own decisions. Now, this is a shocking statistic. Children can die if they ingest too much fluoride. They get poisoned from it. But we're not taught as dentists that it's toxic. Yet fluoride has a similar toxicity to lead and to arsenic. Would you brush your teeth with an arsenic toothpaste? Now, if I recommended it, told you it reduced tooth decay, would you brush your teeth with arsenic? Still not seeing any yeses. So it hasn't been approved, but it's okay as long as you spit it out. Are you going to use it? No. But that's no different to fluoride toothpaste. You need to spit it out really well so you don't get too much fluoride in your system. However, kids can't spit. They can't spit out properly, and they end up swallowing it every time they use it. Even older kids can't manage to spit it all out. I can remember as a kid, because we weren't allowed sweets and lollies, it's minty, and I'd get a big glob on my finger and I'd eat it. And I look back and I was eating poison. I'm lucky I'm still here. Maybe it's because I didn't have any mercury fillings put in my teeth that I've managed to survive. It's no different to fluoride toothpaste. You need to spit it out really well. There is actually a lethal dose of fluoride in one tube of toothpaste for a 20 kilogram child. 8 years and under, if that child swallows that tube of toothpaste, they're going to get poisoned. So if they decide to swallow it, it can actually kill them. And the guidance is to get them to hospital immediately for intravenous calcium, iodine and vitamin C to offset the fluoride. And it has happened. Kids have died from swallowing too much toothpaste. As dentists, we should have a duty of care, just like a doctor to do no harm. We need to protect your health. Dentists need to protect your health, especially when everything that we've got taught at dental school is wrong. Well, I've been fortunate enough to have access to some great books written by holistic dentists, access to meetings and training materials, mentors, to be a member of the International Academy of Oral Medicine and Toxicology, which is a scientific branch, and they're responsible for investigating the impact of dental techniques and the materials on the health of the body. Through this, I've developed and widened my understanding and what I will and won't use in my practice. Through my exposure to holistic teachings, holistic dentists, holistic educators and organisations, I've developed and widened my understanding. I'm very, very picky about what materials and treatments we do in our practice, what we use and what we don't use, and how we work. I've become SMART certified, which means I'm certified in the safe removal of mercury fillings. The International Academy of Oral Medicine and Toxicology is based on scientific evidence. It's not woo-woo, it's not guesswork, it's science and evidence-based. That has turned dental teaching and training on its head. Now, I'm a great believer in the truth, and telling my patients and you guys here when you join me live or watch the replays or hop over to YouTube, I believe in telling you the truth. I want you to have the facts. I want you to be able to make an informed choice so you can understand about the biological impact of dentistry on the body, and let's focus on creating health and well-being. So we do this by removing burden of infection, burdens of toxins or poisons, and the burden of bad oral health. I want you to have optimum oral health and to help you achieve that, because it's going to not only help you save your teeth and have a lovely smile, it's going to keep you fit, healthy. It's going to give you a long life. It's going to help you fill those years and not just teeth. Now, we can't have optimum oral health with a piece of string. What do I mean by that? I'm talking about floss. Yes, flossing helps, and I'm not saying don't floss. Please do not misquote me. Flossing helps, but it will only remove bugs on the surface of your teeth and on the superficial layer of your gum. The bugs that cause gum disease are actually swimming in the fluids deeper down inside your gums, and floss will not remove this, and it will not affect that. So we have to knock all the stuff off the teeth first. So that's what we do when you're at the dentist. That's what we're asking you to do when you brush and floss. We want to knock all those bugs off the teeth and off the upper layers of the gums. Then we've got to flush the gums out. We've got to get rid of those bugs and disinfect them. So oral health is very, very tightly knitted and joined and responsible and has an impact on systemic health. It's not just problems in your mouth. It also seeds inflammation and bacteria to the rest of your body, and this impacts on your whole health. About 2,000 years ago, Hippocrates said, "Show me the health of a man's mouth, and I will show you the health of his body." Now, I get to look inside the body when I look inside the mouth. This is what we as dentists do every day. If there's infection there, if there's inflammation, bad breath, which is caused by nasty sulfur groups coming out of the tissues from bacteria, these things help to tell us about the health of your body. Now, the good thing is you can improve upon this by getting rid of the bad bacteria that accumulate, having proper dental cleaning where we can, and we disinfect the gums. Otherwise, we're going to send a whole army of bacteria into the bloodstream. It's important that you learn how to disinfect your mouth at home too. So systemic health goes from the mouth on. The mouth is the start of your digestive tract. It helps keep good bacteria healthy. You want to keep those healthy so that they can suppress and hold down and stop the bad bacteria from breeding and taking over. Many things like your diet, taking antibiotics, and even having mercury fillings in your teeth knock out your good oral and your good gut bacteria. So the key is not to kill the good guys, but encourage them to grow right. Ensure that we have a balance of health in your gut by taking proper care of them. When your gut becomes inflamed, your whole body becomes inflamed, and this can lead to chronic pain, brain fogs, immune disorders, and chronic fatigue, for example. So it's really important that we take a good look at what's going on in the mouth, get this healthy, as well as addressing the rest of the body. Now, this starts from childhood. Kids do not have the dexterity to clean their teeth. So if you're a parent, you need to take an active role in cleaning their teeth, just like you do when you're cleaning everything else for them when you bathe them or help them after a trip to the toilet. You would not expect a 4-year-old child to be able to wipe their own backside efficiently. I apologise for being so graphic. So why would you let a 4-year-old child brush their teeth and think that that's effective without you helping them to follow up and do it properly for them afterwards? Help them look after their mouth. Now, my rule of thumb is if they can't tie shoelaces, then they can't brush their teeth properly. And even if they can tie their shoelaces, you should still be checking up and making sure it's getting done properly. So correct diet is really essential to prevent tooth decay. Poor diet's going to lead to poor bacteria. It's going to increase your risk of cavities in your teeth. You're going to get holes, you're going to get tooth decay, and you're going to need fillings. So eat real food, feed yourself and your kids a good diet. Get some vitamin D from being in the sun. Very lucky here in Australia, we can do that very easily. But you do need to get sun exposure as much as you can without getting burnt. Get plenty of antioxidants and minerals from your diet and suppress those bad bugs by avoiding sugar. Sorry, I got very Birmingham then with a bit of bugs, which my friends in the UK will enjoy. So yeah, don't get those bad bacteria up and revved by giving them sugar. Now, back to fluoride. I'm all over the place today. I've been having a big rant. So fluoride is an unapproved drug, but dentistry is promoting it. And I believe that's an inappropriate way for a profession to behave. What's the driving force behind pushing fluoride? Well, The American Dental Association put their seal of approval on it. They're patented, so they get a share from toothpaste, mouthwashes, etc. that contain fluoride. Do you know fluoride is rat poison? It kills whatever it comes into contact with. So, let's put happy faces on toothpaste and pretend it's okay. Now, fluoride leaks out of cement plants, from brickwork plants, and from the phosphate fertiliser industry. It damages crops and cattle if it gets into the water supply. So these industries can't dispose of it. And at the end, they're left with a big pile of waste. And if that raw, untreated waste goes into the water supply, we now call it fluoride. We're calling it fluoridation for oral health, for prevention of tooth decay. But it's waste. It's waste from industry. It's coming from countries like China, Mexico, and Japan. And they sell it to us, to America, to the UK, to Australia. Forgot where I lived for a moment there, because those countries that can't put it in their water supply have really stringent policies around disposing of it in the water. But they're more than happy to sell it to us to support what I call a fake oral health policy. Yeah, it's crazy. It is really crazy, Felicity, I agree. So something like 500,000 tonnes of fluoride is used in the water supply in the USA, and millions of dollars have been spent on promoting it. In the USA, they've been spending millions of dollars promoting fluoride, so that we've come to a point where we believe it's great and we're not questioning it. But where is the science? There is no statistically significant difference in the rates of tooth decay whether the water is fluoridated or not. The science shows it causes dental fluorosis, which is poorly developed enamel on our teeth. There's also a correlation between higher risk of hip fractures. There have been studies done recently showing reduction in IQ due to neurological damage from ingesting fluoride. I'm going to say it again. It's a fake program, and it's going to also, what it does is if you're having fluoride in your water and there's lead in the water, or you're getting exposed to lead in the environment, fluoride actually increases that lead absorption into the bloodstream. This policy is not supporting our health needs, and it's not supporting our oral health. We have to address diet and proper care. All that fluoridation is doing is promoting disposal of hazardous waste. I can't fix things that bad oral health causes, but I can fix the infection and the disease in your mouth. So look, if you've got heart disease, that's linked to gum disease. I can't treat your heart disease, but by treating your gum disease, I can reduce inflammation and I can reduce things that make your heart disease worse. We've seen cases where people's levels of C-reactive protein, which is a marker for heart disease, actually becomes lower after treating active gum disease and getting that under control. So I can help treat the infection and disease in your mouth and support you to prevent it. But we've got to work together with a good medical team to address any health symptoms. So we've got to use the science of the body to figure out what's going on and why, and then how we can heal it. So, for example, if you've got a thorn or a splinter in your foot, it can't heal. We've got to remove that thorn and help your body to heal. It's the same with what's going on in your mouth. We need to reduce and remove infection and inflammation. Get it at the source, such as the buildup of tartar around the teeth or an abscessed tooth. Get your mouth and your body well so you can live a long and healthy life. After all, we're here to fill years, not teeth. So I want to thank everyone who's been here. Thanks for listening to me go on and have a bit of a rant tonight. If you're looking for a dentist who really cares about your health and well-being, is not going to use fluoride or mercury fillings, is going to support you and educate you on all the things you can do to have a healthy mouth and healthy life, then please call us and come and get booked in for a consultation. Our number is 07 037201811. My team will be more than happy to look after you, and I look forward to meeting you. And you can see that I even rant in my dental office, and sometimes I'll go off on one when we're having a chat and talking about what's going on in your mouth. Now, you guys are the best. You're the best for joining and taking the time to be here. I really appreciate you being part of the Dental Zone podcast. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia, and number 07372011811, or jump on over to holisticdentistry.au to find out more. And in the meantime, thank you for being in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.